welcome. Yes.
Now it's seen, no?
Yeah.
I welcome you all for our 10th webinar program organized by our DiagnoPool team. So, have you ever wondered how many cells our body is made up of? Yes, we are not alone. Still, the exact number is not clear. The scientists have told that there are 30 to 40 trillion cells in our body. But still, whether the bacteria and viruses are included, still not clear. There are different types of cell in the body. Stem cells, bone cells, blood cells, muscle cells, fat cells, skin cells, nerve cells, endothelial cells, gonadal cells, pancreatic cells, and cancer cells. These cells can be present in the body in a normal format, or some pathology can be associated with this. To identify what exactly what pathology is affected to which type of cell, we do something called as cytology. So cytology is the study of these cells. Cytotechnics is the technique used to study the cells. Cytology tests are the tests which are ordered by the clinicians and to draw the type which we use to take the cells out. It can be in the form of fluid or tissue. These are called as cytology tests. There are different types of tests which we will be studying today. So to talk about this topic, I call upon Dr. Navya, the Professor of Pathology, KVJ Medical College, Sulia. She is the Professor of Pathology at KVJ Medical College. She has completed her MBBS from Adi Chinchandgiri Institute of Medical Science, MD Pathology from KMC Mangalore. She has the vast experience in diagnostic and academic field of pathology. She's been the guide for postgraduate students. She has also been gone as examiner for both undergraduate and postgraduate students. She has also been appointed as an academic secretary in KVJ Medical College Hospital. And also she's been appointed as an associate editor of KVJ Med News, and she holds the responsibility of compiling and editing the activities of the college. She has worked for other organizations like Indian Medical Association as treasurer for tenure of 2 years. She has several publications at both national and international level. Over to you, ma'am.
Thank you, Dr. Divya, for a wonderful introduction. Very good afternoon to one and all. Very good evening to one and all. It's my pleasure to be with you all this evening to share the basic knowledge on cytotechnics. Now, as Dr. Divya told, what is cytopathology? It's a branch of pathology wherein we deal with the interpretation of the cells which are taken from the tissues or the fluids to determine the diagnosis. Dr. George Nicol Papanicolaou in 1920 invented this branch. He is called as father of cytopathology. There are two branches in cytopathology, exfoliative branch and aspiration and interventional cytology branch. In exfoliative cytology, we will be studying the cells that are shed off naturally, so that we are getting the effusion cytology, and the other branches, abrasive cytology, wherein here we are exfoliating the cells by doing a manual scraping and brushing. Examples for this abrasive cytology is cervical smear cytology, your bronchial lavage, washes, and bronchial brush cytology. The next branch is your aspiration or interventional cytology. Here, the healthcare providers, that is your clinicians and the pathologists, will intervene with the body and will get these samples using a fine needle. That is why this technique is called as fine needle aspiration cytology. Now, why do we receive cytological samples? What is the role of cytopathology? Mainly in the diagnosis of cancer. It helps in assessing the response to therapy in the follow-up of previously diagnosed cases. It helps in identification of benign neoplasm in the diagnosis of specific infections, namely the tuberculosis, in the intraoperative pathological diagnosis, that is the imprint smears, and in the assessment of hormonal status. It is for this reason we'll be getting the cytological samples to screen for the not only for the diagnosis of the malignancies, but also to identify benign and infectious diseases. Now, what is the advantage of cytopathology? It is a non-invasive procedure, helps in faster reporting. Unlike your histopathology, here the cytopathology, the turnaround time is within 1 or 2 hours you will be getting the report. It is relatively inexpensive. Since because of the faster reporting, it has a high population acceptance. It facilitates cancer screening. Practice of diagnostic cytology needs the properly trained cytopathologists, cytotechnologists, and cytotechnicians. Accuracy of the report depends upon these 3 factors: the quality of collection, preparation, staining, and interpretation. Quality of collection depends upon the clinician and the pathologist. Preparation depends upon the technicians. Preparation, staining depends upon the technician, how well they stain and how well they prepare the slides. And it also depends upon the interpretation. That is why it is a teamwork. The accuracy of the report, psychological report, it's a teamwork. So it depends upon all, it is depending on all these factors. Coming to the laboratory techniques, these are the steps involved in cytological sample or processing of cytological samples. First is collection. After collection, we'll be fixing the smears. Then we'll be processing and we'll be preparing the slides. Then finally, staining and interpretation. Now we'll be studying one by one. First is, what are the different types of cytological samples we receive in the laboratories? This can be classified into gynecological samples, which means that we'll be receiving the samples from the female genital tract, and the other samples include non-gynecological samples, which includes respiratory samples, GI samples, urinary tract samples, body fluids, and other samples. Now coming to the first one, gynecological samples. The samples obtained from the female genital tract is called as pap smears. Now there are a variety of samples which we receive from the gynecological samples, which includes lateral vaginal smears to assess the hormonal status, vaginal or wall smears. Why do we receive this vaginal and wall smear samples? For the detection of endometrial and ovarian cancers, cervical smears to screen for the cervical malignancies, combined smears which includes both vaginal and cervical smears, and the last one is endocervical and endometrial aspirations. Now, how to collect this pap smears? This is a traditional method of collecting pap smears, where pap smears are collected by the gynecologist using a spatula and cervical brush. The sample is collected from the transformation zone, where it is rotated 360 degree. Then once the sample is collected, it is smeared directly onto the slide. After that, it is spray fixed for the fixation. Now after collecting the sample, you are spreading it onto the slide. Then immediately you have to use the fixative. Commonly gynecologists, they will be using the spray fixative. Then once it is fixed, it is sent to the laboratory. Now what happens in this method is, around 80% of the collected sample remains in the cervical brush itself. So that it goes into the dustbin. Okay. So to overcome this, what is the recently nowadays all the laboratories, what they are using is liquid-based cytology. Now what do you mean by liquid-based cytology? This means we'll be studying the cells through a liquid medium. This was first introduced for pap smears and was approved by Food and Drug Association. Thereafter, nowadays we are using it for non-gynecological cytology also, like fine needle aspiration cytology and fluid cytology. There are 2 techniques in liquid-based cytologies: thin prep cytology and sure pack cytology. Here, the procedure of collection and the principle is different in both these liquid-based cytology, but the ultimate result is the same. Now, how to collect the samples in thin prep? After collecting the samples in the transformation zone using cervical brush in thin prep, what they are doing is they are putting this brush into the vial, thin prep vial containing the methanol fixative, so that whatever the cells which have been taken goes into this vial. Then sample immediately is preserved and sent to the laboratory. So in the laboratory we'll be receiving the cervical smears in solution. So this is placed inside the machine. Here, using the principle of filtration, the cells gets randomized into the slide like this. The advantage of this method is the background remains clear here. The obscuring elements is removed in this thin prep cytology. SurePath, almost a similar procedure is there in SurePath. Now, how is it different from SurePath? Is here, after the sample is collected, the device, the cervical brush is left inside the fixator and it is sent into the laboratory. This is the difference between thin prep and SurePath. Thin prep, they are rinsing the material into the vial and they are taking off this brush. In SurePath, they are leaving this device into the container and they are sending along with this device. This is the difference between the collection of thin prep and SurePath. Now, what is the difference between all these three methods? Conventional method, thin prep and SurePath. The fixation used for the conventional method is ethanol, thin prep is methanol, SurePath is ethanol. Collection, the smear is spread onto the slide. Here I have already said the sample is rinsed in the vial like this. The sample is rinsed in the vial. Here in the SurePath, the collection device is left in the vial. I have told you the device will be left inside the vial. Cell sample, there will be a random distribution like this in conventional method. In thin prep and SurePath, there will be uniform distribution like this over the slide. The other differences are the collection device in conventional method is EC brush, spatula. Here it is again the EC brush and spatula, and cervex brush rinsed in vial is used. Here cervex brush most effective, the tip is deposited in the vial. Means what? The brush is left inside the vial here and then it is set. Now what is the difference and what are the other differences is, here the preservation artifacts, the air drying artifacts, the inflammation, everything is there on the slide here. All this preservation artifacts is removed or is reduced in this liquid-based cytology. That is why the sensitivity and the specificity for liquid-based cytology is more when compared to conventional methods. This is how the slide looks in conventional smears, where the background is hemorrhagic and inflammation is there, obscuring the cells. Whereas in thin prep and SurePath, the background remains clean so that even the minimal details, the earlier stage of cervical malignancies can be detected in liquid-based cytologies. Now coming to the other samples. Now till now we have dealt with gynecological samples. The other samples we received in cytology lab is respiratory samples, which includes sputum. The specimen can be obtained from the patient either spontaneously or aerosol induced. Usually early morning sample is collected in a wide mouth container. 3 to 5 consecutive samples should be examined to ensure maximum diagnostic accuracy. Usually we prefer unfixed specimens compared to prefixed specimens. Other respiratory samples includes bronchial brush, washes and Lavac specimens. These specimens, usually the respiratory samples are sent by the respiratory medicine consultants. Now bronchial brush, after inserting the bronchoscope, what they are doing, they are brushing the lesion where the smears are prepared immediately onto the slide. After preparing the smears are both alcohol fixed and air fixed and they are sent to the laboratories. In the bronchial washes, what they are doing, they will be inserting the bronchoscope, then they will be introducing 5 ml of normal saline through the bronchoscope, then they will be aspirating the solution. Immediately, the fluid is sent into the laboratories. In the Lavac specimens, how are we receiving the Lavac specimen? Here, what the clinicians will do, they will insert the bronchoscope. Then they will be inserting 20 ml. They'll be flushing with 20 ml of normal saline through the bronchoscope. The Lavard solution again is recollected. The procedure is repeated for 4 to 5 times. So overall 40 to 50 ml of solution is procured and the bowel fluid is sent into the laboratories. The other samples, till now we dealt with gynecological samples, respiratory samples. Other samples includes the effusion samples where the fluid is sent. For which are the different types of fluid which we receive in cytology? Is pleural fluid, pericardial fluid, CSF fluid, ascitic fluid. Collection of fresh effusion samples should be collected in the clean container. No fixative is needed. In case if it is an hemorrhagic, then anticoagulation should be mixed. 1:9 ratio of ammonium oxalate or heparin can be used, or even EDTA can be used. What are the precautions to be taken for the effusion samples? Suppose in case if you are expecting a long delay in processing, then you have to mix it with equal amount of 50 ml of ethyl alcohol. Do not allow the fluid to be frozen. Effusion samples, you should never froze the sample. Other samples includes the urinary tract samples. In the urinary tract, you will be receiving voided urine, bladder washings, and ureteric urine for cytology. Among these specimens, the voided urine is the preferred sample for cytology. We usually collect the second voided urine in a clean container. Ideally, no fixatives to be used. The sample to be processed immediately inside the laboratories. Endoscopic specimen for cytology. Endoscopic specimens, not actually they will be receiving the specimens. Usually, they'll go for biopsies. Next type of sample is buccal smears. They receive buccal smears to determine the sex chromatin. Now, how to take out the buccal samples? Mouth should be rinsed with water or normal saline. Buccal mucosa will scrape. This is how they'll be scraping the buccal mucosa with a wooden spatula or a brush. Then the material is immediately smeared onto the glass slide. Then it should be put into the fixative. Once it is placed in fixative, then they'll be doing pap stain. See, this is how the bar body looks. If bar body is there, then it is female sex. If absence of bar body indicates male sex. Okay. So till now we dealt with the exfoliate. These are the different kinds of exfoliative samples we'll be receiving in cytology labs. Other samples is interventional samples, that is fine needle aspiration cytology. Here, this is usually performed by the clinicians or the pathologist. The cellular samples are obtained through inserting the needle and using the negative pressure like this. This is valuable in diagnosis of lesions like breast, thyroid, lymph nodes. In case of non-palpable swellings, then there will be non-palpable swellings, meaning when the swellings are there in the liver or lungs which are not palpable. In such situation, guided FNACs, either ultrasound guided or CT guided FNACs are preferred. Now, how to prepare? Though the procedure is performed by the cytologist, pathologist, preparation is done usually by the technical people. So, what all things you need to keep it ready? Different gauges of needle starting from 24 to 19 gauge needle. Smaller needles will be using for hemorrhagic samples like thyroids when the vascularity is more. Then, so always when you are taking for FNACs, always you should be ready with the different gauges of needle, syringes with the syringe holder. This is a syringe holder. Coupling jar with the fixator, cotton swab, glove, forceps and slides. Aspiration cytology, there are two methods using negative, that is FNAC with aspiration, and FNAC without aspiration. FNAC with aspiration means here the holder, the syringe is attached and negative suction is used, whereas without aspiration only needling is done. This procedure is done mainly in case of thyroid FNACs. Now, what is the procedure? You will be inserting the needle into the lesion. Then you will be giving the suction, that is the negative pressure we will say. Then you will be redirecting the needle at all angles. Then you will be releasing the negative pressure. Once you release the negative pressure, then to put the material onto the slide, you have to detach the needle, take the negative, then push the material. This is how it is done. You'll be pushing the material, then you'll be spreading the slides. For FNSEs, both alcohol fixed and wet fixed smears are preferred. I'll be telling you what are air dried and wet fixed smears in the further slides. Now, we finished with collection of samples. These are the different samples we'll be receiving in cytology. Now, let's move on to the fixation and fixative methods. Rapid fixation is necessary to preserve the cytomorphological details. If smears are allowed to dry prior to fixation, there will be marked distortion of the cells. So, these are the different fixative methods used in cytology: wet fixation, air fixation, spray fixation, also called as coating fixative, lysing fixative for the bloody samples, and liquid-based fixation. This I have already told you. There are two methods, that is thin prep and sure path methods. Now, let's see one by one. Wet fixation. See, the method of fixation depends upon what stain your cytologist or pathologist wants. If your pathologist wants MGG stain, then what fixative you should use? It should be air dried smears. Now, what is air dried? I'll be telling you in the further slides. If your pathologist wants path stain, then always you should be fixing it with alcohol. That is why it is called as alcohol fixed or wet fixed smears. Now, coming to the first method of fixation, wet fixation. Usually there are different classifications. Various fixatives are available. In cytological fixators, the classification goes on like this: nuclear fixators, cytoplasmic fixators. But usually in all the laboratories, they prefer alcohols. Now, which is the ideal fixative in cytology is majority of the laboratories will be using 95% ethyl alcohol. This is called as ethanol. There are other fixators, wet fixators also, like 100% ethanol, ether alcohol mixture, 100% methanol, isopropyl alcohol, isopropanolol, and denatured alcohol. But among all these, the ideal fixative is 95% ethyl alcohol. It has it can be used as a dehydrating agent also, and they give good nuclear details. The time of fixation is minimum 15 minutes. You should fix the smears. You can prolong the smear for several days or even for weeks also. If the smears are preserved over a long period of time in alcohol, it is better to store in a capped container in a refrigerator. Now, coming to the next method, dry fixation. Now, what is this dry fixation? You will be spreading the material and you will be drying it. This is what is air dried smears. When I say wet fix smears, it means that you will be fixing it with alcohol. When I say air dried smear, it means that you will be spreading the material and you will be keeping it for drying like this. Okay. If we are doing air dried smears, always we should use this Romanowsky dyes, Romanowsky stains. I'll be teaching you in the further slides. Next method is coating fixatives. Usually gynecologists will be using this coating fixatives. Now, what are these coating fixatives? The other name for coating fixatives is spray fixatives. This is aerosol based or liquid based, and it has a dual action. The alcohol content in it will fix the cell. The wax based substance will form a protective coating so that the cells are not dislodged. Commercially available preparations like cytosprays are available. If this is not there, even the hair dry, the standard hairspray containing diaphragm solution, which is rich in alcohol content, can be used as an alternative. When do you use this coating fixatives? When you want to transport for the distant labs, then you can use this coating fixatives. Usually, this is not recommended for bloody smears. Now, how to use this? Once the smears are smeared, once the material is smeared onto the slide, even before it gets dried, this one, the coating fixative or spray fixative is sprayed onto the material. After spraying the material, during the spray, the distance between the nozzle and the slide should be 15 to 25 centimeters. After spraying, it should be dried for 10 minutes. Then only it should be wrapped and it should be transported. The caution is, this is a caution for the technicians. Now, once you receive inside your laboratories the coat spray or the spray fixators, prior to staining, the slides have to be kept in 95% alcohol before staining. This is what you have to follow. Now coming to the hemorrhagic samples. Now how to process the hemorrhagic samples? Whenever the sample is bloody. So whenever the sample is bloody, you need to lyse those hemorrhagic material. So what fixatives you'll be using? You'll be using Carnoy's fixative. What the Carnoy's fixative will be containing absolute ethanol, chloroform and glacial acetic acid in the ratio of 6:3:1. In this, acetic acid will hemolyze the red cells. It is an excellent nuclear fixative. If Carnoy's fixative is not available, even other solutions can also be used like Clark solution or 1 drop of concentrated hydrochloric acid per 500 ml of 95% ethanol, 10% glacial acetic acid. Nowadays, commercially available cyto-rich wet fluid is also available to lyse the RBCs for the hemorrhagic samples. Special fixatives, special purpose fixatives are for thin prep system will be using methanol as a fixative. For short pack will be using ethanol as a fixative. For a cell block, 10% neutral buffered formalin is used as a fixative. Now we're finished with air dried, wet fix, hemorrhagic fixative and coating fixative. Now let's move on to the next fixative, that is rehydration of the air dried smears. Sometimes the gynecologist will be sending the cervical smears as air dried. So in such situation, how to use the sample? Usually for gynecological samples, we'll be using wet fix smear. Now how to convert this air dried smears into wet fixed? This is a simple method. This has been given in Acta Cytologica in 2013. In that study, what they have used is, they have used 50% aqueous solution of glycerin. Then they have rinsed with 95% ethyl alcohol. So with this, you'll be fixing the sample. Then you can be doing the pap staining. This is how they are rehydrating the hair dried smears. Or you can use even normal saline also. Usually they say for non-gynecological smears, you can use normal saline. We have tried with for gynecological samples also how to rehydrate this using normal saline. The advantage is lesser risk of cell loss and ease of collection. Now, how to preserve the sample prior to processing? Usually all cytological samples should be processed immediately. If it is not possible to process immediately, then it should be kept it should be refrigerated depending upon the mucus content, protein content, sugar content and pH content. Suppose in case if the sample is with no sugar, no protein and with an extreme pH, then there is no point in refrigerating. You should process immediately. If the sample contains high mucus or a blood or protein content, then you can refrigerate for 24 hours. Maximum time is you can refrigerate for 24 hours. So that the sputum and the effusion samples you can refrigerate up to 24 hours. Whereas urine samples and CSF samples, if they contain low mucus and protein content, maximum time to be refrigerated is 1 to 2 hours. Whereas gastric aspirate, they are low in pH, immediately they have to be processed. Now coming to processing of the samples. Now we are finished with the collection and fixation. Now moving on to the processing of the samples. Now how to process the samples in cytology is, these are the different methods of processing of the samples. Direct smears, centrifuge, and we will be preparing the slides, cytocentrifugation technique, liquid based preparation, millipore technique and cell block technique. Now when to use this technique? So direct smear will be using for sputum samples. So when will you centrifuge? When the amount of fluid, when we receive moderate amount of fluid, 50 to 100 ml of the effusion, then we'll be centrifuging it and we'll be preparing the slides. If the sample received is less than 1 ml, example is CSF and vitreous fluid, in such conditions we'll be using cytocentrifugation technique and we'll be preparing the slides. If the amount of fluid collected is more than 100 to 500 ml, example is urine sample, then we'll be using this millipore filter. If you want the sample for if you want to send the cytological samples for immunohistochemistry, then cell block technique is preferred. Now let's see one by one. Now how to prepare the sputum sample? Pour the sputum sample onto the petri dish, pick up the greyish material or the bloody material or the tissue fragments, put it onto the slide and smear the specimen. Fix it immediately with 95% ethyl alcohol. Now, how to prepare the effusion samples? As I already said, by centrifugation. Take the fluid in the centrifuge tubes, centrifuge at 1500 rotations per minute for 10 minutes. Discard the supernatant, take the sediment, make the smear from the sediment. Once you prepare the sediment, few slides you have to air dry, few slides you have to fix it with ethyl alcohol, 95% ethyl alcohol. The now next technique is cytocentrifugation. When do you use the cytocentrifugation? Whenever there is a hypocellular specimen. In that situation, we'll be using cytocentrifugation. Now this is a cytocentrifugation machine. These are the funnels. You will be putting the samples into the funnels so that, and this is an area where the slides have been kept. So once you keep it in the cytocentrifugation machine like this, then it should be spinned at, the samples has to be spinned at 2000 rotations per minute for 2 minutes. Sediment cells will be directly put onto the slide like this. Okay, like this. Now the next technique is millipore filtration technique. This is used mainly for the urine specimens and when the collection of the sample is more. Now how do we use this technique is, this technique contains an upper cup, then the lower cup, then the flask. You'll be putting the fluid inside the upper cup. Here the filter is placed in between the upper cup and the lower cup. Using the negative suction, the fluid is drawn from the upper container. The fluid passes through the filter paper. Then the filter paper is pressed onto the slide. Then after that, both air dried and wet fixed smears can be prepared out of it. And the last technique is cell block technique. When do we use the cell block technique? Mainly for when we want immunocytochemistry, cytochemistry, and for the preservation of the tissue for the further use, we'll be using the cell block technique. How do you collect the sample? The fixative is 10% neutral buffered formalin. We have to keep it for 4 hours in formalin to fix the cells. Later, what we do is we'll be taking the aliquot of fluid, we'll be centrifuging it. Then, after centrifugation, the supernatant is decanted, then the sediment is left. We'll be pipetting out the remaining fluid. Then to this, there are various techniques available for cell block techniques. The articles has given more than 10 techniques are there. Depending on your lab, this one you can prefer. Now after this one said, after you get the sediment, you can add plasma and thrombin, or you can add the melted agar, stir it, refrigerate. After refrigeration, you can put it onto the cassette, fix it with formalin. Then the procedure remains similar to that of your histotechniques. This is how you can prepare the cell block procedures. Now coming to the staining methods. Staining methods I've already described. The stain depends upon what type of fixative you have used. If you have used air dried smears, then always you have to do Romanowsky, you have to stain it with Romanowsky dyes. The Romanowsky stains includes Ginsa stain, McGranwald MGG stain, then Leishman and Wright stain. If the slides are alcohol fixed or wet fixed, then always you have to go for PAP stain or hematoxylin and eosin stain. This H&E stains are usually used for FNSCs. Now, in cytology, among all these stains, usually they will be using PAP stain and MGG stains. Now, what is the difference between these two stains? PAP stains is good if you want to study the nuclear details. MGG stain is good if you want to study the cytoplasmic details and if you want to study the background details. Keratin demonstration is done only with PAP stain. Now, coming to the first stain, PAP staining method. This was named after George N. Papanicolaou. The stain is named after him. It is a polychrome stain, most important stain in cytology. It is a very most important stain and it is used for all cervical smear and even for non-gynecological smears we can use this PAP stain. Now, what are the features of this PAP stain? It gives good cytoplasmic differentiation. It helps in assessment of cellular differentiation. Nuclear details are well seen. It is a transparent stain and it demonstrates intracytoplasmic keratin. There are two methods in PAP stain, the progressive method and the regressive method. Now, what is the difference between the progressive method and regressive method? In progressive method, the nucleus is optimally stained and the cytoplasm does not take up the dye. Now, what is regressive? Regressive means intentionally you are overstaining the methoxylin dye and subsequently you will be removing the acid alcohol. This is how the stain looks, the progressive and regressive stains. Now, what are the dyes in Papanicolaou stains? Usually, there are three main stains in Papanicolaou stains. Hematoxylin stain, which will stain the nucleus. The two other stains are cytoplasmic stains. These are the counter stains for cytoplasm. Orangey stain, which will stain the keratin, and eosin azure will stain the cytoplasm, which gives up green color. This is the cytoplasmic stains. Now, eosin azure, it contains three dyes: eosin white, light green, that is why the cytoplasm is taking green color, light green SF yellowish, and Bismarck brown. Now, coming to the evolution of PAP stain. There are different PAP stains have been followed. PAP stain has undergone lot of changes over the years. There are different formulations available by different vendors. Each lab will have their own SOPs. Starting with conventional PAP. This was initially only conventional PAP was available. Later, rapid PAP was invented. Then ultra-fast PAP modified. Then they modified this ultra-fast PAP. There is something called as environmental PAP, which is environmental friendly. Then REAP PAP is there. What is this REAP PAP is? REAP is rapid economical acetic acid PAP. These are all the recently developed PAP, but majority of the labs, they go with conventional PAP and rapid PAP. So I'll be discussing only this conventional, rapid and ultra fast PAP. These are all the other PAPs where the time duration is reduced, but this one, it will mimic the conventional PAP. Whatever the PAP is there, the basic principles of Papanicolaou stain is you will be rehydrating the smears with the graded alcohol. First, you will be doing the nuclear stain using hematoxylin. Then you will be using the bluing agent with a weak alkaline solution. Then you will be doing the cytoplasmic stain. There are two cytoplasmic stains, as I have already said, Orangey and EA. Then finally you will be rehydrating, clearing and mounting. This principle remains the same for all the PAPs. Coming to the conventional PAP. So the conventional PAP has 29 steps. As I already said, the procedure remains the same. First, you'll be rehydrating the slides with graded alcohols. Then you'll be using the distilled water. Then you'll be staining the nuclei with hematoxylin stain. Then, if it is a progressive method, there is no need of using alcohol. If it is a regressive method, then you should use the alcohol. Then you'll be using the bluing agents. Then you'll be you'll be dehydrating the slides with different grades. Two cytoplasmic stain you should use. Orangey, again you'll be rehydrating. Then EA, other cytoplasmic stains. These are all the conventional methods. Nowadays, majority of the labs, because of the time constraint, nobody is following this method. But this stain, though it has so many disadvantages, the old pathologists, the senior pathologists, whoever is there, usually they will be following this method only. What precautions you should take if you are using this conventional PAP, since you are using many of the dehydrating agents like alcohols. Many times you will be using the alcohols. Lot of alcohol has been consumed. The containers, as you all know, the alcohols are all evaporated. So the concentration of the dye will be changing. That is the reason you should be using airtight containers if you are using this alcohols. And the containers should be washed regularly. Hematoxylin solution is a stable solution. So when it fades, then you should change the hematoxylin solution. Orangey, the strength of it it usually goes off very quickly. So every now and then you should be changing this Orangey. Xylene, immediately when it becomes tinted, you should be changing. So all these precautions you should take when you are using conventional PAP. So what are the troubleshooting methods? These are the troubleshooting methods. If the nucleus is stained too dark, then what you should do? It means that you have kept the Harris hematoxylin for the longer time. Then you have to reduce the time. If it is too less, if the nuclear stain is too less, it means that you have kept it in, I don't know, you have de-stained for a longer time. Then you have to maintain the time. So these are all the troubleshooting methods. If the nucleus is too pale, so what could be the reason? Dimethoxylin is diluted, so you have to change the solution. Too less bluing means give time for bluing. Too much concentration of hydrochloric acid means you have to maintain the concentration of the acid. Improper cytoplasmic stain, if it is there, it means that the smear is air dry prior to fixation. Then you should try to fix it properly. So these are the possible causes and possible remedies. So it is already given in many of the books. You can just go through the books. Now next method is rapid PAP method. Majority of the laboratories are preferring this method, rapid PAP, because of the time constraint. I think this I have taken from the leaflet only. I think majority of the labs, even in your labs, I think your people are following this rapid PAP only. First, you'll be starting with hydration, where for 3 to 5 minutes, you'll be hydrating the smear. Then after that, you'll be using the nuclear stain. Rapid PAP nuclear stain is there. Then 3 to 5 drops of wash buffer you'll be using for 20 seconds. You'll be dehydrating using a dehydrating. Then cytoplasmic stain is used. Cytoplasmic, I have told there are two cytoplasmic stain, 2A and 2B, means OG and EA. So when you are putting onto the slide, you should be mixing equal volumes of OG and EA. Then you'll be pouring onto the slide. Then you'll be washing the slide, dehydrated, then clear and mount. This is how you'll be using the rapid PAP. Now, what are the disadvantages of this conventional and rapid PAP methods? More than rapid PAP, the conventional PAP has more disadvantages when compared to rapid PAP method. What are the disadvantages? As you all said, you know the time duration is prolonged in conventional PAP. Wet fixation is time consuming. Air drying artifacts are more, and most of the cells are lost during the interpretation, before interpretation. Hemorrhagic background will be retained in both rapid and conventional PAP. Loss of cells will be there. The conventional PAP is time consuming, though the rapid PAP is not time consuming, but the hemorrhagic background is left in rapid PAP. That is why even this has disadvantages. So to overcome all these, the next method what they are using is ultra fast PAP method. So what is advantages over this rapid PAP and conventional PAP is, here we are drying the slide. Once we dry the slide, then later we'll be using this normal saline. To fix the slide, we'll be using, to rehydrate, we'll be using normal saline. I've told in my previous slide, if you use normal saline, what will happen? There will be lysis of RBCs, so that the background remains clean. That is the advantage in ultra fast PAP. After that, you'll be fixing in a mixture of 4% formaldehyde and 95% ethanol. Then finally, it will be stained with Richard Allen methoxylin and cytostatin. The time sequence taken is only 90 seconds to complete it. So these are the different PAP stains. Whatever it is, for all cervical PAP smears, depending upon your lab SOPs, we'll be doing the PAP staining. All cervical smears to be stained with wet fix smears to be stained with PAP stains. The other stain used for the wet fix smears is HMD. This will be using mainly in cytology, will be using for cell block technique and for FNACs. For cell block technique, the procedure remains similar to that of your HMD. We'll be deparaffinizing first, then we'll be rehydrating for 1 to 2 minutes. Then we will be using the nuclear stain for 5 to 10 minutes. Then we'll be differentiating. If it is a regressive stain, then we'll be differentiating using 1% acid alcohol. Then the bluing agent is used. It is counter-stained with eosin, dehydrating and clearing and mounting. For cytological, for FNACs, what HND will be following is rapid HND will be following. We'll be skipping this deparaffinization step, and the nuclear stain, the time duration is reduced here, 1 minute. Rinse the slide in tap water, put the methoxylin for 1 to 2 minutes, rinse in tap water for 5 seconds, Scott tap water for bluing, dip in eosin, rapid, then rehydrate, dip in xylene, then mount. This is the rapid HND method. Now coming to, this is what is about the wet fix smears. Now coming to air dry. As I already said, if it is an air dried smear, so what fixation, what are the stains you'll be using? You'll be using Romanowsky stains like Giemsa, MGG and Leishman stain. In cytology, among all these stains, which stain is best is MGG is the better stain. So MGG is performed on air-dried aspirates or fluids. It is superior to pap stain to study the cytoplasm. If you want to study the nucleus, then we'll go ahead with pap staining. If you want to study the cytoplasm, we'll be going ahead with MGG stains. So MGG, as the name says, there are two solutions, Grunwald stain and Giemsa stain. So this is a solution. Grunwald stain and Giemsa, this is the ingredients. Now how to stain this? MGG staining. Stain the smear in Grunwald stain diluted with equal volume of distilled water for 5 minutes. First you will be staining with Grunwald for 5 minutes. Then you will be staining with Giemsa solution. But you should be diluting with distilled water at each step. This Giemsa stain, you will be staining it for 8 to 10 minutes. After that, you will be washing with distilled water. Then you will be drying. So this is how the nucleus will be taking a blue color and the cytoplasm will be taking a pink color. Later, if you want, you can mount it. Okay. Now, in many of the times, your cytologist or your pathologist will be asking to destain it or restain it. Now, how to destain and restain the smear? Dip the smear in the xylene until the cover slip drops. Once the cover slip drops, then you have to treat it with acid alcohol for 20 minutes. Then wash the smear with running tap water. Then you can use for restaining. This is how you will be destaining. Destaining means still here you will be doing. If you want to restain, then you will be restaining. With this, I'll be coming to the end of my slides. That is coming to the summary. Cytological examination plays an important role in the initial workup to find out the possible etiology as benign or malignant. Samples must be carefully prepared, fixed, stained in its journey to microscope. This role is played by the technicians. The ISC recommendation and guidelines to be followed in all accredited laboratories to ensure quality in laboratory cytology practice, which in turn will help and impact on patient care and management in clinical practice. Any questions?
You're free to ask questions to Madam.
I want to make one clarification here that very often my technical staff keep having doubts when there is a pap smear, what stains we should do. They have this confusion. Even just 3 days back, I will not name where, but I had to see a Leishman stain pap smear. That also happens, they get so confused between FNAC and pap smear, So I want to clarify, when this FNAC, for the benefit of some people who still have doubts, you have a choice. In FNAC, you can do a air dried or a wet smear. As Madam pointed out, you can do a Giemsa or a Leishman and pap. But for a pap smear, you please do only a pap stain.
There is no alternative. It's only pap stain.
Yes, that is a very basic
Because mainly we are doing pap stain to study the nuclear detail. It is a screening test to detect the malignancies. So always the cervical smears, you have to go with the wet fixed smears, then stain it with pap stain.
Yeah, and I think they are not doing the first step. Some labs have observed that rehydration, what you mentioned in rapid pap, putting in tap water and all that, maybe they are skipping that, and then we get very suboptimal results.
That is the reason we are getting all that air drying artifacts.
Yeah. When you told that, I realized.
Even after this one, even in my labs, even after me telling so many times, I would have seen the clearing step would have not been proper. That muck and that opacity will be there. Now, why is that opacity? How to reduce this opacification is the clearing with xylene is very, very important step. Otherwise, you will be seeing only the air bubbles inside. This will be obscuring the nuclear details.
Correct. Any other questions?
Actually, this topic was very nice. Actually, many staffs won't know, for dry slides, what are the stains used? For wet smears, what are the stains? Actually, this topic, I think, for most of the technicians, those doubts will be cleared.
Correct. And how many smears do you stain, Navya, in your lab? Supposing that some 10 FNAC slides, do you stain all the 10 of them or you choose some?
No, usually what we do is, we will do an alternative wet fixed and air dried smears. Meaning whatever the material is there, first few slides only alternative 4 to 5 slides will be staining. Rest of the material we will centrifuge it. If it's a fluid aspirate, we will centrifuge it and we'll make 1 or 2 slides out of the centrifuge samples. The screening, whatever the slide comes to your table, all the slides should be screened. So to avoid that, we'll be staining only 5 to 6 slides. That's it for FNACs.
Yeah, that's decent enough, I think. And cytochemistry, have you done in your college anytime? Cytochemistry?
Oh no, we are not yet started immunocytochemistry.
I don't have much experience.
That is the reason I didn't include immunocytochemistry.
Yeah, practical.
Usually only with the higher labs they will be doing with the immunocytochemistry.
Correct.
But here we do have a course of allied health science courses. BSc MLT, PMLTs, all those courses are there. For them, actually, it is required. It's a topic.
Yes.
Immunocytochemistry, all those things is a topic.
Hi, ma'am. Hi, ma'am. Very good evening.
Very good evening, Mahalya.
Very nice presentation, ma'am. It was very nice to hear. The entire presentation was very good.
The entire presentation?
Yes, I didn't miss any.
Thank you so much.
Ma'am, what are your comments on the rows, ma'am? Is it still worth practicing the rows for any benefit to the clinician? And how fast, we'll be able to only differentiate to some extent whether it is benign or malignant or pick up some points on the Rose technique. But what are your comments, ma'am, over that?
Regarding which technique you are talking about?
The rapid onset cytological evaluation, that without any stain, if we see the smear, is this applicable only for the adequacy, or can we still go one?
Diffquick method, majority of the labs are using. But
yes.
In KMC, what we were following, actually, Zubair knows about it. We have learned to seeing the FNAC adequacy in unstained only.
Correct. That is what?
I think even you knew that.
Yes, ma'am.
We are assessing even now. In unstained only, usually I assess. But
yes.
Here, few of my colleagues, they follow the Diffquick method to just see the material adequacy.
Okay. So it will be applicable and apt only to look into the adequacy of this.
We will be assessing only that slide, whatever adequacy. But for the first hub material, whatever we push, we'll be pushing into the wet fix slide.
Right. Yes, ma'am.
We'll be putting onto the wet fix slide, so the material might be there in that also.
Correct.
So ideally, what we prefer for the patient is, we'll ask them to wait for 10-15 minutes outside. If required only, we'll go for second passes. But nowadays, what we are following here is majority of the thyroids, even though they are palpable, will be going ahead with the CT guided and ultrasound guided FNACs. Especially thyroids, all thyroids nowadays we are going ahead with guided FNACs, because though the swelling is big, majority of the times we would have missed the nodule small, because the lesion will be there only in particular area. They would have given Tirats 4, Tirats 5. But here for us it's a very big swelling. We don't know which area they are talking about. So now we are not following that without guided, we are not doing anything. With guided only we are going with for all thyroids.
Correct. So everything depends on.
Even though it is they would have given Tirats 2, we are going ahead with guided FNA.
So each and every case is different. We have to take a decision depending on the clinical
scenario. The pathologist, how they are there. There, you people are following in your labs. You are following this one FNACs, guided FNACs.
Yes, ma'am. We have an interventional radiologist.
Interventions are done by the radiologist or pathologist?
Both, ma'am. Both. Few cases, yes, the radiologist itself does the interventional procedure and sends the slides to us for reporting. And there are two radiologists who does that. So one takes the assist from the pathologist also.
Okay.
So either ways, yes, ma'am. Ma'am, in few labs where there is no facility for a cytocentrifuge, can we do the normal centrifugation by just increasing the rotation?
That I wanted to actually tell. Here, cytocentrifuge, initially we didn't have cytocentrifuge. So what in our madams had taught us is, either you can use egg albumin, a drop of albumin when you don't have, but when the material is very less, when you have only 1 or 2 ml, like CSF samples,
CSF.
but you
Yes,
don't
ma'am.
have the cytocentrifuge. In such situation, you can use serum, either serum or you can use egg albumin. Though the muck particle is there, but the clot would have retained.
Okay.
The
Okay.
sediment, in that sediment, definitely you would have seen the cells.
Okay. Okay. Fine, ma'am. Thank you so much, ma'am.
You're most welcome, Ahalya.
Thank you, sir. Zubair, sir, thank you.
You're most welcome, Ahalya.
Ma'am, what is your experience about radiologists doing aspiration and pathologists, the smear difference, ma'am?
Smear difference, actually, whatever FNSA, it is better that cytologist will be doing the FNSAs compared to the radiologist.
Because most of the smears, when we're done by radiologists, no, we get very, very less cellularity.
Less material, that's what. The technique, what they use is very different from us. First, what we will be doing is, though the needle insertions they are putting, we'll be knowing how much to put the negative. For thyroids especially, we know how much to put. For other fibrous tissues, which needle to use, which gauge needles to be used.
Any other questions? I kindly request all the staff attendees here to fill the feedback form. Thank you, madam. Thank you for such a detailed discussion. Actually, it was very interesting. I wish everybody who here, at least they would have been come up with one question at least, because it's a daily procedure which every day we use.
I think Madam covered every aspect of it. That's why there are no questions. There were certain things I had in mind, but it was a comprehensive lecture.
Thank you, Dr. Zubair.
Thank you.
Thank you, madam.
Thank you. It was nice being with you people.
Yeah, same here. Nice. Okay. Thank you.